Hello everybody, and thank you for watching this short video which I was asked to perform for you by WHO and the Integrated Care for People platform. My name is Mirella Minkman. I'm the CEO of Vilans, and Vilans is the National Center of Excellence in Long-Term Care in the Netherlands. Besides my role at Vilans, I'm also a professor at Tilburg University, and my chair is about the innovation of the organization and governance of integrated care. And also I have the honor to serve in the board of the International Foundation for Integrated Care. Today, my idea is to share with you my ideas and some thoughts about what's important when we look at the future of integrated health service delivery. As you probably know, there's quite a body of knowledge about integrated care, integrated services, and how we can develop that further in a number of countries. But to look at all this knowledge, I think it's important if we can define some components where we can work on, and also reflect on them, and to see what's really important if we want to progress further and develop integrated care further towards the next level. And for that reason, I developed a kind of a framework, or you could say an overview, about 4 important components I think that are important for the future development of integrated service delivery. And when you look at this picture, you can see that the first of these components is about people. And that's important, because when I see and I look at integrated service delivery, the starting points are the total needs of people. And that's important, and that's something different than looking at health needs or what's important to deliver. It's about looking at persons in their context and to see what really matters to them, what they think is important, and what their needs are that go beyond care. So that's the starting point also for organizing your integrated services. The second component in this picture you see is about the organization of integrated services. And when you have the starting point of the needs of people or groups of people, then it's always important to organize services and care around their needs. So we know a number of examples, for instance, about interdisciplinary teamwork, integrated care teams, integrated care pathways. We know that they can help and support to organize more integrated care and have less fragmented situations. That's important, and it's also important that it goes beyond the healthcare domain. When you look at the third aspect, then it's more about how can we organize that and on what level can we do that. And in my definition, I would draw some more attention towards the component of scale. And by scale, I mean more knowledge and understanding, and maybe rethinking in the practical situations, what is the most appropriate scale to organize these support and services for people. For instance, is it most appropriate to organize it more on a level in the neighborhood, which is more local, you can say, or on a more level in the region of a specific country? Or is it important to have it more above the level of the region, or maybe on a national scale? Rethinking what's the appropriate scale is important, and I think maybe gets too less attention at the moment. Besides that aspect, it's also important to realize that because we have digitalization, scale also gets another understanding. Because when we look at geographically, a distance which is now long or far away, so you can say another country or whatever, can be very near when we use digitalization and have these connections. So scale differs and also develops because we have a more global approach of, for instance, using knowledge of experts who can support in the delivery of healthcare. When I go to the fourth component on the picture, then the connection after scale issues is how we can organize local governance. And by that I mean the development that we see that when you look at integrated total needs of people, you often have to work together. You have to collaborate between professionals, but also between different healthcare organizations. And making these connections, working together, asks for different types of local governance. And by governance I mean for instance, leadership. Also, how can you steer the activities that should happen, but also how can you reframe maybe your accountability or the supervision about what healthcare services are delivered. Traditionally, we focus on the organization as an entity and we try to optimize the outcomes of the organization. But when we look at the total integrated care needs of people, that's no longer the most important issue. Then you would say, how can this organization, for instance a nursing home or welfare organization, contribute to the societal needs there are for a group of people? So it's not about optimizing organizations or good outcomes of organizations, of professional groups, but it's about how can we have impact in societies. For instance, when you look at elderly people, and an aim could be that people want to live at home as long as possible, how can a local welfare organization support that aim that we have in society? And if you start from that point of view, then governance looks different than when you try to optimize organizations. So then you come to developing network governance models or shared governance models. And that's important. So this picture, I think, gives an overview of 4 important components that support integrated service delivery in different countries. Besides these 4 components, which can be helpful when looking at further development of integrated services, it's also important to realize how we make decisions and what do we need for making good decisions to reduce fragmentation and have better outcomes for our societies and people. For that reason, it's important to realize and have an understanding about what knowledge do we have and how can we use knowledge to make the best decisions possible. In that purpose, it's important to realize that we don't have all answers from science yet. So, as a source of knowledge, you could say, it's not only important to use science, but it's also important to use expert knowledge, but also user experiences and perspectives. Besides that, we know that we can think and define all kinds of activities. We can try to improve processes, care processes, system refinement, etc. But integrated service delivery is also very people related. When you want to collaborate, then it's very important how you do that, with what persons, based on what drivers can you collaborate. Also to see and to experience if that collaboration can be successful. And also, besides more attention for the aspect of scale, I think it's also important to have more attention for underlying values that are important for people. Because underlying values drive behavior. For instance, if someone thinks efficiency is a very important value, that can be visible in decisions that a person will make or actions or behavior undertaken by that person. So underlying values are very important when we look at behavior. And also that is a topic that could have more attention also to support integrated service delivery and make implementation and development more effective. The work of Nick Sonneveld, which is one of my PhD students and also a colleague at Vilans, focuses on these aspects of values because we saw that there was too less attention for it and also not really well formulated knowledge about what are underlying values of integrated service delivery. So the work of Nick has been undertaken and resulted in a new study which will be published soon in collaboration with WHO. This study showed that it was possible to define underlying values of integrated service delivery. And as you can see in this figure, we defined eventually 18 values that are underlying integrated service delivery. And important is that we also looked at these values in different contexts, in different settings. In the study, 42 countries were involved, and we looked also from different perspectives at these values. And in this figure you can see the 18 values who are in the circle. And when we did analysis about these values, we saw that about half of them were merely focusing also on people-related issues, and the other half was more focusing on how to organize and how to how to implement your governance models. So that's really important because it contributes to the conceptualization of integrated service delivery. And often you see in definitions that there's a combination between people-oriented aspects or activities, but also about organization and governance. So this framework can be helpful to get a better understanding of what values are underlying maybe in your network in which you collaborate with your local stakeholders. What also was a striking finding is that in all settings, in all different countries, of course, who are really different, have different cultures, settings, healthcare systems, etc., all those 18 values were defined as relevant. So you could say that although contexts differ, underlying values were all confirmed. But what we also found was that the value hierarchies, and by that we mean what values are the most important for people, differed between different subgroups. So we found that, for instance, clients do have other value hierarchies to these values than, for instance, researchers. So that means that when you ask people, do you think these values are important? They all say yes, but when you ask them, but what's the most important to you? Then they make other choices. And that's important information, because when we realize this, we know that when you have a perspective, for instance, as a decision maker from in a government situation, or you have the perspective of a client, you think you all want integrated health service delivery, but the underlying values have different priorities. And you can use this work and this research to have a look at what are the underlying values in my situation. Do I know which values are the most important? Can you make them explicit? And are there different value priorities between the stakeholders you're working with? So this part of knowledge can contribute to a deeper understanding of how we can organize integrated health service delivery. And we hope to release some publications and report about these underlying values very soon. So, in a nutshell, this is what I wanted to share for you at this moment, and I hope it helps you a little bit to have a better understanding about what components are important for organizing integrated health service delivery, starting from the total needs of people, organizing support and care around them. See how can you arrange that, on what level, what scale is very important, and what new governance models do we need to redefine, to reinvent that better fit having impact on issues in societies. And underneath that, it's important to realize it's all about people. It's about behavior, how we make decisions, and what values do lie underneath. Well, thank you very much for watching this video. I hope it will support you a little bit in working on your integrated service delivery in your own country. And please, if you have any questions, do not hesitate to contact me. Thank you very much.